FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz, and we have the pleasure of having Dr. Luiza Petre with us today. She is a board-certified cardiologist and weight management specialist, really extensive training in the area, been doing this for over 10 years. And originally, Dr. Petre, you were just going to be with us to discuss improving your health, weight loss, and lifestyle change. And I should also mention that that you are the house doctor of the New York Philharmonic, so you know something about spreading of disease, etc. It's kind of like having a doctor on at this point. You have to address the 800-pound gorilla in the room, the whole pandemic and everything. Do you mind saying a couple words about that first?
Yes, Gary, we are definitely in the middle of a major crisis, and this is unfolding as we speak.
Okay.
It's something that we have never seen in our lives before, and as we are seeing the number of cases growing exponentially, we definitely listen to what Dr. Fauci says, and we take his advice. He's definitely a voice of reason and rational here. We are probably 2 to 3 weeks away from the peak of this. There are still a lot of cases that are undiagnosed. They got infected probably before we implemented this social measures policies. And also, probably there are a lot of asymptomatic carriers that are still spreading the disease. So the math is simple here. We have to intervene at 2 levels. First, yes, to address what's happening with the hospitals right now, supplies and demand for beds and medical personnel, but also to cut this chain of transmission from the root. We do need to implement, as I said, math is simple. We have to take the incubation period of the virus, which is around 2 weeks, and take 2 to 3 times the window, so let's say 4 to 6 weeks before we see we basically mitigate and vanquish this pandemic. So at this point, it is really, really important that all of us take this sense of social responsibility and stay at home and just cut down on the social velocity, because each of us can contribute to spreading to this.
Yeah, and the thing is, you never know who's going to be the person spreading it, who has it. Obviously, if you have symptoms, then you know, but if you're asymptomatic, you're just not going to know. So it's serious, but this isn't the end of the world. We're going to see a peak. Medical resources are strained, but there is a light at the end of the tunnel, isn't there, with the new treatments that the FDA just fast-tracked?
Absolutely, Carrie. We got to stay optimistic here, and that's my nature. I think we'll get over this. Unfortunately, we'll have some emotional and human lifestyle in this, but there are some good news coming out there. Number one, I saw Governor Cuomo just saying today, announcing that we are seeing a slightly slowing down in the number of new cases, and that's fantastic news. That means it works. We stay home. And also, another good news, just I saw today, the Abbott Laboratories just launched a test that will give results in 5 minutes, and that will be fantastic, because we can identify the new cases very quickly. People don't have to go out and stay on massive long lines to wait to be tested. They could actually make up to 50,000 daily of these kits, and I think soon enough they'll definitely prioritize the healthcare providers, but soon enough we might be able to have this test at home.
Yeah, wouldn't it be great if you go to the airport, before they let you in, they give you the test. They know instantly, 5-minute test, that you don't have it, and then you can get on the plane and we can kind of get back to normal life. Could you ever foresee it going to that extent?
That's definitely very viable because if you think we expect this pandemic to last for a while, it's just the nature of it. It spreads so fast. So even if you initially curb down the numbers, you can always have a second wave coming if you are not careful enough or if you relax the social norms that we have right now. But if you look at some countries like Iceland and South Korea, they have been, and actually Hong Kong, they're going for mass testing. They want to test the whole population. That's how they've been so successful. And actually Germany is going to implement that as well. They're going for whole population surveillance. And you're right about that. You know, in the future, July, August, when this virus is not going to be abolished for sure, but we'll have screening spots everywhere, basically.
Yeah, hey, and originally, Doctor, sorry to sidetrack you on this. Originally, you know, you're a board-certified cardiologist, weight management specialist, and we were going to have you on to talk about that. But hey, I kind of hijacked you because you're an expert, and the really interesting thing is, and I think it is relevant to what you're doing now, if you are in better physical condition, meaning you're at your optimal weight, you're exercising, you're controlling all of those crucial numbers in your blood, your cholesterol, your sugar, your A1C, all of that. Well, then you're in much better chance. You have much better chances of surviving COVID-19, don't you?
FSN Radio. It's all about what's next.
Lumina Gold, ticker symbol LUM on the Toronto Venture and LMGDF on the OTC, is yet another of legendary mining investor Ross Beaty's Lumina Group. It's advancing the largest primary gold deposit in Ecuador. The resource is estimated to contain 16.7 million ounces of gold and 2.2 billion pounds of copper. At just $7 US per ounce gold equivalent, it trades at an incredible 13% of its net present value. More good news is on the way with an updated PEA study expected in Q2 of 2020. It has unparalleled infrastructure. There's grid power to camp with plentiful, inexpensive hydropower available. It's close to 2 ports and is just 8 kilometers from a paved highway. Water is plentiful. It's at low elevation, and the closest community, which is very supportive of Lumina's effort, is just a 7-kilometer ride. With all this going for it, it's likely to follow the typical Ross Beaty formula, which means big returns to shareholders. Find out more and sign up for notifications at luminagold.com. That's Lumina, Lumina gold.com.
The Financial Survival Network. It's all about what's next.
Definitely, Kara. The reason why I'm doing what I'm doing, yes, I'm a cardiologist at the root, but I have changed my practice towards preventive medicine. And what I've learned, and I see a common denominator in all my cardiac patients, is overweight and obesity being the root of most of ailments we have. So my approach is basically, yes, health starts with your weight. If you cut down your weight by 10%, you decrease 80% any chance of chronic medical condition. So, yes, going back to your point, how this mirrors into this coronavirus pandemic, all these people have these comorbidities. They had an unhealthy lifestyle before. And unfortunately, I wish I could say, yes, it's never too late to start, but I don't know if this is the time to start losing weight, but I can say what you can do, at least when we are stuck inside our house. Let's be more mindful. Let's focus on ourselves. Let's try to eat healthy. Let's think about the future, what we can do.
Yeah, and it's effectively what you said is if you can lose weight, 10% of your body weight, then 80% of your problems go away. So what we're really saying, and this isn't anything new, is this is a lifestyle choice that you've made, maybe not even knowing that you've made it, and that if you do it right, you can easily reverse it the same way that you got it. And if you're healthier, than all disease. You're more resistant to all disease. Your immune system probably is going to be functioning close to optimal levels. And if you do get sick, you're going to be able to get over it much easier than someone who isn't in good physical condition.
You're absolutely correct, 100% on everything you have said. Our immunity starts from what we eat and our lifestyle.
Yeah, it's so important, and it's so easy to lose sight of, and yet, it's really the most important thing you have is your health, and you've got a series of weight loss clinics. I've been to one in Florida here, helped me lose 25 pounds. It was the best move that I ever made. So if you're dealing with weight issues, really to get medically supervised by a doctor is really the best approach to going towards this, isn't it?
It is incredible to see how much power losing weight and what you eat can have toward your health. And this is really something that we haven't looked deep enough as a society, but we're getting there. And these times are times of reflection. Moving forward, it's going to change all of us and how we think about our health and values and what we do for ourselves. So I'm sure, and when we come out of this, we'll be wiser and reflect more on our choices.
Hey, and a really good point is one good thing that's coming from this whole pandemic, the attention to personal hygiene, the idea of washing your hands quite frequently, which is prevalent in the medical profession. Every time I see a doctor, he or she's washing their hands, and really individuals will be doing that. So there's going to be probably a dramatic decrease in normal influenza transmission as a result of this, and the other thing of sneezing or coughing into the crux of your arm, into your elbow, rather than on your hands, just makes a lot of sense. If we keep up as a population with our renewed interest in hygiene and spreading disease, this is going to have dramatic long-term effects, isn't it?
Definitely, we're going to see us slowing down in the future influenza outbreaks. I think we even had this year somewhere close to 18,000 deaths already during this flu season. It's going to change all social norms and behaviors. Will probably go to micro for a while. We'll take more personal space in our interactions, less handshaking. It's going to be a change for all of us, for sure.
Yeah. Yep. It's definitely going to be a change. Well, anyways, it's really been a pleasure having you on here, Doctor. Can you just give us your website? So if you're in the New York metro area, you can contact the doctor and start losing that weight now.
Definitely, I'll be happy. It's www. My name L as in Larry, U umbrella, I India, Z zebra, A apple, T as in Paul, E echo, T Tom, R Robert, E echo.com, MD, LuizaPetreMD.com. Thank you so much, Carrie.
All right, and there's a link in the show notes to the doctor's site, so you can check it out for yourself. And there's no time like the present to get started. You got. One thing that's bad is you're sitting at home and you got limited entertainment options available. It really is tempting to just hit the pantry or the refrigerator, and you wind up gaining weight. So start thinking about losing your weight today. Doctor, really appreciate you coming on. Any questions or comments, I'd urge all of you to email me. I'll forward them to the good doctor, kl@carrielutz.com. That's the email address, kl@carrielutz.com. Twitter feed @carrielutz. Facebook page, Financial Survival Network. Our website, financialsurvivalnetwork.com, where you can sign up for your free newsletter. Doctor, it's been a pleasure. Thank you so much for coming on.
Thank you, Carrie. Always, anytime.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.